Hello viewers, now let us discuss for some time about what diet a diabetic individual ought to take. There are a lot of misconceptions about diabetic diets. Fat diets do exist as ever, and in order to maintain a healthy body in diabetics, it is essential to consult a qualified dietitian or a nutritionist or an endocrinologist or a senior physician who can guide you as to what diet a particular individual with diabetes ought to take. Do remember the fact that diet plan ought to be individualized. Every human is different. More so if they do have diabetes, because their medications could be different, their other comorbidities, that means other health issues that they have, would be different, and also the fact that their nutritional requirements could be different. Hence the reason why people with diabetes should not follow any fad diets and stick to the diets scheduled to be taken by them and given to them by a qualified dietitian or a doctor. In this context, let us try to discuss what are the main constituents of our diet in general. The main constituents of our diet in general are macronutrients, that is carbohydrate, protein and fat. Let us try to discuss about macronutrients, but before we go to macronutrients, let us talk a few words about micronutrients. What are micronutrients? Micronutrients are those nutrients that are present in very small quantity. Example, vitamins, minerals, etc. If we come to macronutrients, which constitute the major proportion or chunk of our food, we do have carbohydrate, example rice, wheat, etc., etc. And if we go to the other chief nutrient, we do have protein. Example of protein is egg white. We have fish, which is also purely protein, and we do also have milk, which is again a rich source of protein, and not to forget the dal that Indians regularly consume. So these are all examples of proteinaceous foods. Proteinaceous foods in fact are essential for every human because they are the building blocks of our muscle and body. They are very much essential for repair of our body, which happens day in and day out. And then if we come to fat, the examples are ghee, the various oils that we consume with our knowledge or without our knowledge in our foods. And oils are also important if taken in adequate amount in our body, but too much of it can be detrimental because they can increase the cholesterol levels in the body and also can cause problems like obesity. Coming back to carbohydrate, we do have two types of carbohydrates in general, called complex carbohydrate and simple carbohydrate. Examples of complex carbohydrate are rice and brown bread, etc., etc. What happens when we consume carbohydrate? This carbohydrate is broken into small pieces in our digestive system with the aid of enzymes in our digestive system and gets absorbed into our bloodstream and ends up as glucose. The reason why I am discussing this is this helps us understand the difference between complex and simple carbohydrate, and that gives us an explanation as to why we need to be consuming complex carbohydrate and avoid simple carbohydrate. Examples of simple carbohydrate are honey, sugar that we consume, and when we consume these, they easily get absorbed without much breakdown in our digestive system, and the blood glucose levels increase significantly in a short span of time. Hence the reason why we ought to be consuming more of complex carbohydrate and less of simple carbohydrate, irrespective of whether we have diabetes or not, and more so if an individual has diabetes. Otherwise, the diabetic person's blood glucose levels surge significantly when they take the simple carbohydrates that we have discussed so far. Then comes the concept of glycemic index. What is glycemic index? In simple words, if a food that we consume were to increase the blood glucose levels significantly, then such a food is supposed to be a high glycemic index food. Examples of high glycemic index foods are your pasta, your white rice, and then don't we have low glycemic index foods? That means foods after consumption of which the blood glucose levels don't increase significantly. Yes, we do have, and examples of such foods are your brown rice, brown bread, etc., etc., after consumption of which the blood glucose levels don't increase significantly because it takes a little more time for these carbohydrate foods to break down and get absorbed into the bloodstream. So that's the difference between your simple carbohydrate, complex carbohydrate, low glycemic index foods and high glycemic index foods. Then comes the concept of how much of which macronutrient do we need to take. There are rough guidelines as to how much one should be taking in terms of carbohydrate, in terms of protein and in terms of fat. But the general rule is cut down on fat in your diet. Try to increase the protein content of your diet because in general, Indian food is deficient in quality protein. And try to cut down the carbohydrate in your diet, especially the simple carbohydrate, because that increases the blood glucose levels in people with diabetes. You can take complex carbohydrate, and this is only a rough guide. If a person with diabetes were to have kidney problems, then they need a tailored special diet as advised by their dietitian or by their doctor. So this is about how much amount of which particular nutrient a person with diabetes ought to take. Then comes the concept about salt. Why is salt important? Does it really increase blood glucose levels? The answer to it is no, salt does not increase blood glucose levels. Then why is it relevant in people with diabetes? Because most diabetics have high blood pressure, and the combination of high blood pressure which can be triggered by excessive salt consumption can in fact be a dangerous combination if a person were to have high blood pressure as well as high blood sugar levels. 1 plus 1 does not become 2 when it comes to the risks of complications in a diabetes with high blood pressure, and 1 plus 1 becomes 4 or 5 in terms of the increased risk of complications such as heart attack or kidney problems if a person were to have uncontrolled high blood glucose levels as well as uncontrolled blood pressure, and if the person were to be diabetic. Hence the reason all diabetics ought to cut down the amount of their salt intake and restrict it to less than 5 grams per day. Studies have shown that in India, people with diabetes consume a lot more salt than that is required, somewhere around 8 to 15 grams per day, which is way more than the recommended salt intake. Hence the reason why it is important to cut down the salt intake in our food. Then comes the concept of junk food. Do we really need to avoid junk food? The answer to it is yes. Whether you have diabetes or not, it is very important to cut down the quantity and frequency of junk food. Junk food means processed food or foods that are fried or foods that are readily available in supermarkets, etc., etc. Why is junk food dangerous? Because junk food contains lot of fat in it. Junk food contains less nutrients. Junk food contains lot of simple carbohydrate usually. Hence the reason why we advocate people with diabetes to cut down on processed foods such as pizzas, burgers and processed meats that are readily available and not cooked at home. Having said that, it is also important to cut down on sweets or the good old Indian sweets, which also come under the category of junk food. Why are we calling Indian sweets as junk food? Not just because they are rich in your sugar, but they are also rich in fat content as well. A word about sweets that are made with artificial sweeteners, which is one of the concepts that is going around these days. I would strongly urge viewers to stay away from sweets even if they are made with these artificial sweeteners as they proclaim, because of the very fact that even if such sweets were to be made with non-sugar sweeteners, what happens is when a person with diabetes consumes these, they automatically add lot of fat into your diet, and they automatically add lot of calories into your diet, and they cause significant weight gain. Hence the reason why I am advocating to cut down the processed foods, including the good old Indian sweets that people are all fond of. Then comes the concept of artificial sweeteners. Can they be taken in tea, coffee, etc.? Artificial sweeteners are readily available. It's a large unregulated market. Most people with diabetes are fond of taking sugar, but unfortunately because they are asked not to take sugar, they resort to taking these artificial sweeteners. Unfortunately, some of the artificial sweeteners can do damage to the kidney, the brain and the liver, and as I previously mentioned, they're largely unregulated across the world. Hence the reason I would urge the viewers to cut down on their consumption of artificial sweeteners as well, because they may cause damage to their kidneys, liver and brain, apart from other organs. So this is about artificial sweeteners. Then comes the concept of which oil is good for a diabetic. Strictly speaking, no oil is good for anyone. But having said that, it is better to avoid trans fats, that means processed fats that are used in junk food and that are readily available in your biscuits, so on and so forth. It is advocated to use better oils instead of your coconut oil in your diet, and use the better oils such as olive oil and also your sunflower oil if you want to use a certain oil in your diet, because these come under the category of good oils compared to the bad oils. Then comes the concept of alcohol, whether a person with diabetes can consume alcohol at all or not. It is a different topic on its own, but suffice to say that alcohol should be consumed in moderation, or if one is not fond of it, it's better to avoid it altogether. But if somebody is really fond of it, please cut down the quantity of alcohol intake, because alcohol itself adds a lot of junk calories to your diet, and also the fact that alcohol has other deleterious effects on your body, such as on the liver. It can compound the chances of developing fatty liver in a person with diabetes, especially if they are obese, and it is advocated to avoid alcohol, especially if somebody has excess triglycerides in their blood, because alcohol is known to increase bad cholesterol called triglycerides as well. So for all these reasons, it is better to cut down or avoid alcohol as much as possible if somebody were to have diabetes. Then many people ask us about when to take food, how much to take. Simple common sense should be followed and used when taking the timings of your food. Breakfast ought to be somewhere between 7 o'clock, 8 o'clock in the morning, because you haven't been eating all night. Unless you break your fast, you are at high risk of hypoglycemia, that means low blood glucose levels, if one were to get diabetic. Then comes lunch. Lunch, as it is supposed to be, ought to be between half 12, that means 12:30 at noon to somewhere around 1 o'clock. It should not be delayed too much, otherwise the person can have a low blood glucose level because of the medications that the person is taking. Then comes dinner. Many people leave their dinners to night 10 o'clock, 11 o'clock, and if a person is a diabetic, then it is not advocated to leave their dinners till night 10 o'clock and 11 o'clock. They have to have their dinner as early as possible, sometime between 7 o'clock and 8 o'clock at least at night. Then comes the concept of healthy snacking. Healthy snacks are available, such as your nuts. In moderation, they're supposed to be a healthy snack. There are a lot of other healthy snacks as well that your dietitian or your doctor can tell you, and these can be taken sometime between your breakfast and lunch, that means around 10 a.m. in the morning. You can also take a healthy snack sometime in your tea time, that means around 5 o'clock or 4 o'clock in the evening. So if you follow this simple schedule, this is not necessarily something which everybody need to follow. This is a simplified schedule for most diabetics. I think the blood glucose levels would be reasonably controlled if you follow a healthy lifestyle along with this. And not to forget, the most deleterious complication of diabetes because of medications that they use, that is hypoglycemia. What is hypoglycemia? Hypoglycemia in simple words is low blood glucose level, and hypoglycemia occurs to a diabetic if they do more exercise or work than usual, if they don't take food on time, if they suddenly cut down their food intake, or if they change the quality of the food that they take normally. So I would urge the viewers to please take similar type and quantity of food on a daily basis, periodically, as per a proper schedule. Do remember please that you don't have to weigh your grains and take accurately the same quantity in grams, but please make sure that you maintain a similar sort of quantity, food quantity daily. For instance, if you take this much rice today, if you take this much rice tomorrow, your blood glucose levels are bound to go high tomorrow because of the excessive amount of rice that you're taking. So ladies and gentlemen, I think so far we have discussed at reasonable length about some general principles pertaining to diabetes and diet. Thank you very much. So ladies and gentlemen, for tips about good health and about various complications and prevention of various health problems, please stay tuned to Health Masters. Thank you.